Hello. You have to excuse me not looking my best. I wasn't really intending on recording one of these things today, and I'm also flushing from my disease modifying drugs. So yeah, sorry for the appearance. I just wanted to record this because I got back onto the trial again and started taking my drugs last night. And now during my lunch break, I'm at home with the kids. I ate my food, and about an hour later, I'm now getting really quite bad stomach pains, sort of around here. Feels very similar to what it felt like last time. Now I think if I get it right, the pancreas is here somewhere, and this is where the gallstones are supposed to be, and this whole area here feels really, really tender. I don't think I'm sort of hospital needing. I'm just trying to ride it out at the moment. I've taken some ibuprofen, and I have emailed Dr. Nick to let him know what's going on. But it feels a bit strange since I haven't had the pain since I went into the A&E, and then I came off the drugs, and now I started taking them yesterday and got the pain. I mean, yes, sure, it could be gallstones, but it still feels a little bit coincidental. Anyway, I'm going to stop recording because this is very uncomfortable. Okay. So that was a part of a recording I made 2 days ago when I was feeling a little bit worse for wear, truth to be told. I don't actually remember exactly what I was saying in the clip, but what has happened is I've come back from our holiday, and I was told to start on the medication again on the Monday, and that happened on the Tuesday. It was a rather nasty affair of I'm thinking gallstones, pain, which it wasn't maybe as bad as it was the first time around I had it, but it was still very uncomfortable. I didn't go into the hospital. I was in contact with Adam Brooks, and they did think maybe I should go into the hospital, but as it sort of eased up towards the evening, I decided to stay at home. I was at home alone with the kids, so it felt a bit fiddly to try and get in a taxi and things, and when the pain is that bad, it's really, really hard to talk. Anyway, so I am going to have some more blood tests on Friday. That was planned anyway, just to see how I was doing on the drug, but because of what happened on Tuesday, they've now asked me to stop taking the drug, for now anyway, so I'll have to wait and see what happens. The blood tests and that, I guess I will find out on Tuesday when I go up, and then I shall record anew what is going on. But yeah, it feels a bit annoying, to be honest, sort of off and on and off and on. But on the other hand, that pain was not pleasant. But I'm thinking that it is the gallstones rather than anything else. But it's kind of hard to know, as I hadn't had another attack while I was off the medication, and then I started taking the medication, and then the pain occurred. But it could just be coincidence, but who knows. I've been trying to think really hard what I was eating, if there was anything specifically that could have caused it, but it was all pretty basic, normal stuff, and nothing that was particularly fatty or anything. So I don't know. But I guess this is the way with gallstones. Sometimes you can figure out what it is, and other times not. But anyway, I shall stop here, and then I will let you know what they say up at Adam Brooks for next week. Sorry, it's a bit backwards and forwards, but I suppose this is quite true to what a clinical trial does. I just hope I can remain on it. Okay, bye.